March 8th, 2020. Joe here at Simple Life Show, where the simplest answers are usually the best. Don't forget to subscribe if you have not already done so. Those who have, I appreciate that. People for Bernie and others who have been circulating this math on Twitter. Bloomberg spent $500 million on his election. There are 327 million Americans. So far, that's correct. He could have given every one person $1 million and still had billionaire pocket change left over. So if you've done the math on that, that's a little over $1 something change per million Americans. I thought this was just a gaffe. I thought it was something. Maybe it was from a Republican that was trying to make fun of Bernie's Sanders and his followers' lack of mathematics. We're not going to really get into that, but I thought this was a joke until I saw it on the news.
Somebody tweeted recently that actually with the money he spent, he could have given every American $1 million.
I've got it. Let's put it up on the screen. When I read it tonight on social media, it kind of all became clear. Bloomberg spent $500 million on ads. U.S. population, 327 million. Don't tell us if you're ahead of us on the math. He could have given each American $1 million and have had lunch money left over. It's an incredible way of putting it.
Yeah, it's a real incredible way of putting it, MSNBC. The only problem is that everyone was ahead of you on the math, and they were all laughing at you because you could not simply do the math. This is a problem in this country, that we have people in the media who are just reading stuff. They're not really thinking while they're even doing interviews. They're not thinking while they're reading the news. They're not thinking at all rationally about anything. They're just reading the news because they are parrots for the people who are telling them what to say. And this is a prime example of that. People are losing their minds out there, and they are going towards, and I'm talking about the coronavirus, not just the election. People are losing their minds over that as well. Bernie Sanders got screwed on, on Super Tuesday. We all know that. We know that Elizabeth Warren, the votes for Elizabeth Warren kind of broke everything apart, as well as the votes for Bloomberg. So we know that happened. We talked about the lines. We talked about all that other kind of stuff that was going on that was a little bit seedy, a little bit shady. But at the end of the day, I have a problem with understanding why so many Democrats who are sensitive to the racial issues that are going on in this country, or at least perceived racial issues that are going on with this country, they can't stop talking about race, at least over at MSNBC. They cannot stop talking about it. And they're pretty in your face about calling Republicans white supremacists too.
And the second thing is that, look, white people in America have two parties to choose from. And between those two parties, they sort in all kinds of ways. So people that are college, postgraduate atheists who live in metro areas, like those are Democrats. Right. And people that are rural and go to church every week and were high school graduates, most likely Republican. For black voters in those two categories, they're both going to be in the Democratic Party. Right. Because there's only one party they can be a part of because of the nature of structural white supremacy in America and the political coalition. So
Chris Hayes is doing Chris Hayes. I'm not even sure if that's what he really believes anymore about the world that he lives in, that everyone that does not vote Democrat is a white supremacist, racist, bigot, KKK supporting Nazi. Maybe that's just what he's told to say. I don't know at this point anymore, because all of the pundits out there and the talking heads in the media, they all get their marching orders from those above them. And who knows who is actually feeding all the information. I would imagine people like George Soros and others who are feeding the information to the mass media on which way to direct the public and the popular opinion at any given time. This has a lot to do with what I was talking about before, with manipulation of voters' perceptions of reality and what they believe at any given point in time, because it's always evolving and changing. Sometimes it makes no sense whatsoever. But what I can't get over is how, especially for the Democrats, and how racially sensitive they are, at least they espouse that they're racially sensitive, how they could vote for someone like Joe Biden, who has, over the course of many decades, been very clear about his feelings about other races. I don't have a lot of the clips, but you've seen them, about how they're going to be, how black people are going to be put back in chains if they vote the wrong way, trying to evoke imageries of slavery. We have Joe Biden telling others, especially in these town hall meetings, that black kids are just as smart as white kids. But the way he says it is, poor kids are just as smart as white kids. Remember that one? Remember the story about Corn Pop and him beating the hell out of some black kids? Or threatening to, as it were. There's so many things out there. I mean, all you got to do is just do a search for Joe Biden racist comments. You thought that Trump put his foot in his mouth. You thought Trump was a racist with some of the things that he said or supposedly did, which a lot of it has no proof. Now, I am not a cheerleader for Trump. I know that Trump has put his foot in his mouth so many times. A lot of the things that he said I do not agree with, and in fact, a lot of it has really irritated me and pissed me off. But what I cannot understand is how many Democrats out there are rushing to the polls to vote for this person. And it's not only that. The fact of the matter is that polls have not changed, that Bernie is still the favorite to win against Trump. And I don't even really like Bernie. I don't hate him. Yeah, he's calls himself a Democrat socialist. So what? This is what I'm saying. I think for the people that are so scared of Bernie Sanders and a lot of his radical ideas, and I'm not condoning any of them. The one thing that I do agree with is Medicare for all. I think that with the recent coronavirus outbreak over the world, that this is a good type of argument for that type of thing. The government wants to get involved anyway. Why not make sure the public has some sort of access to care? Now, I know that Obamacare it is not dead yet. You can still buy a policy through Obamacare, and it is somewhat cheap, but the coverage is somewhat questionable too. So we're always going to be in that same boat of, is this going to cover me? Is this good insurance, or is this just some sort of slap in the face to shut me up? I don't know. I mean, that's just what I'm trying to get across to you, is that I'm not sure how people can vote for Joe Biden. Joe Biden is number one. Joe Biden is not going to beat Trump. At the end of the day, Joe Biden was probably the worst candidate to go up against Trump. He's probably one of the candidates that's always done the worst as far as the polls. But we can't trust polls anyway, so I'm kind of arguing against myself. But that's all we have to go on at this point, right? Now, there is a chance that Bernie could come back. There is a chance that we could have a contested convention. And I think that, like I said in my last video, I think that is one of the main goals of Operation Chaos, is to sow seeds of chaos throughout the Democratic Party to make sure that everything is chaotic going into the nomination. And I think that is why you see a lot of these players coalescing around Biden, because that's the last thing that anyone wants, is a broken and fractured Democrat Party. That's all I'm really going to say about this. I mean, we could talk about this to death and not really say anything new. The end of it all, and basically the only thing that you really need to know is that the Democrats are shooting themselves in the foot, even though they're coalescing around one candidate for the most part. Now, we do have some celebrity endorsements. We do have some political endorsements for Bernie Sanders, but it's not the type, and it's not in the amount that Biden's getting right now. Biden is just soaking it all up, and he knows that he is going to get the nomination. And I hope he knows that it's going to be a complete landslide. There's no way he's going to beat Trump, period. The fact is that all these Bernie supporters, they're going to stay home. They're not going to vote for Biden. I hope Biden really knows that. That's what Obama was trying to do in 2016. He was trying to coalesce all of the Bernie supporters who felt slighted because of all the superdelegates voting for Clinton around Clinton. And that, for the most part, that didn't happen. Yes, she got the popular vote, but she didn't get the Electoral College either. She lost the entire country. She might have won the popular vote, let's say, in California, but that's about it. On to the coronavirus. I know that most people are they're getting kind of tired of all this kind of stuff. Let me just go ahead and reload this because I know the total numbers are higher. We're at 107, 443 total confirmed. Total of 3,600 deaths. I know we could go over the numbers over and over and over again, but here's what I kind of want to say about this entire thing. China has been doing actually a really good job at containing this, if they are actually reporting the real numbers. That is. Some people are saying it's all fake. Some people are saying that it's completely out of control in China, and they are just completely shutting down all of the media coming out of China. And I would be inclined to believe that, if that's the case. A lot of people are saying, obviously, that this is no big deal. It's a cold. This is just something that it will go away. And that is true. Viruses will eventually go away after they have done their damage. That is, if they are left completely unchecked, yeah, it could do a lot of damage. But over in Italy, they are really kind of pulling the hammer down. They have actually started to quarantine and isolate millions of people in Italy. Italy has exploded over the last week, and it's actually surpassed Iran, which is kind of strange because they're licking everything over in Iran. Iran's actually starting to take this seriously now, but I think it's a little bit too late over there, because it's within the first couple weeks that you really need to start to contain this type of virus. After that, it's kind of mitigating the fallout. Over in this country, in the United States, we have a problem because we simply can't get tests out and test kits. We want to make a bureaucracy out of this entire thing. We want to have different sections of this country believe that this is all a big conspiracy to get rid of the president. At the same time, we want to have people saying this is no big deal. Just go about your day. Don't even worry about it, blah, blah, blah. That's the kind of laissez-faire attitude that we have over this country because we don't believe anything can actually ever hurt us. But this is not the case. That's not how viruses work. Here is an article from Business Insider. You probably already know about this because it's been out for the last few days. One slide in a leaked presentation for U.S. hospitals reveals that they're prepared for millions of hospitalizations as the outbreaks unfold. I believe that the slide is somewhere in here. Yeah, best case epidemiology. This is with an RO factor of 2.5, doubling every 7 to 10 days. The goal, of course, is to get the RO factor to 1. But that is the best guess. Community attack rate at 30 to 40%. They are saying 96 million cases and 480,000 deaths. I don't think this is going to happen, but it could. It could very well happen. Over here, this Liz Specht, I don't know how to pronounce her last name, but she is Associate Director of Science and Technology. Good food, I guess, industry or something like that. Supporting alternative proteins for sustainable food future, U.S. SD PhD. So she knows what she's talking about. She's not a dummy. And she recently came out with a series of tweets here. She says, I think most people aren't aware of the risk of systematic healthcare failure due to COVID-19 because they simply haven't run the numbers yet. Let's talk math. Okay, so that is one of the things that we really need to talk about because we keep talking about the death rate, the mortality rate, and the new cases and so forth. Yeah, we want to keep a scoreboard. I understand that. But what normally happens is that you have a few cases when you start off with, then they start clustering, right? We see that here in this country. We see the clusters here, the Northeast, the Northwest, Southwest. You see all these clusters happening here in the Midwest. So we're seeing all these clusters happen. And then you'll see more clusters. And then when we get all of these test kits and we're able to start testing people in the correct way, then the numbers will start exploding. And then people will be like, oh, wow, okay, maybe something's going on. But by then it'll be too late, right? We're going to have to let it run its course, and it's going to be even worse in this country. We're not talking about doomsday and stuff like that, okay? Because there's a lot of people that want to say, well, everyone's talking about doomsday. Everyone's talking about the end of the world. This is not going to be the end of the world, okay? But it's also not the common cold. We have done reports. We have talked about how the genetic sequencing of this virus has been manipulated with HIV. How it's been manipulated to attack your DNA, to attach itself, and to lie dormant for up to 24 days before you actually start to show symptoms. Then you can actually, in the next month, you can start, you can just pass it on to whoever you're coming. It's highly infectious. People understand that. Yeah, it's the mortality rate isn't as high, but please understand this, that people are saying that it's the mortality rate isn't very high, especially for young people. They're not considering all of the people with immunodeficiencies. They're not considering the people with heart problems. They're not considering the people with respiratory issues, people with asthma. All of those people. Okay, not everyone in this country is you. Not everyone in this country is very healthy, and it will just be a common cold and stuff like that. It affects people differently, apparently. And we're not understanding that. So she goes kind of on a tirade here, and I think it's a good tirade. And we're gonna read it, because we do need to do the math. We need to have a better understanding of this. First one is, let's conservatively assume that there are 2,000 current cases. Now, if you look back on this coronavirus thing, we can see here that's 437. Those are confirmed cases through a lab, which means they actually put it through a laboratory, confirmed it was coronavirus, and that's part of the official count. So let's assume there's 2,000 now for people that are not tested as of yet. This is about 8 times the number of confirmed lab diagnosed cases. We know this is a substantial number due to the lack of test kits. Next, we can expect that we will continue to see a doubling of cases every 6 days. This is a proven fact. Doubling every 6 days. This is typical doubling times across several epidemiological cases. Here I mean actual cases. Confirmed cases may appear to rise faster in the short term new test kit rollouts. That makes sense. We're looking at about 1 million U.S. cases by the end of April, 2 million by May 5th, 4 million by May 11th, and so on. Exponentials are hard to grasp, but this is how they go. As the healthcare system begins to saturate under this caseload, it will become increasingly hard to detect, track, and contain news transmission chains. In absence of extreme interventions, this likely won't slow significantly until hitting 1% of susceptible population. Please understand this, that the draconian things that both South Korea, Italy, and Iran and China, they are doing because they have to. When you have a type of virus that is this viral, even if the mortality rate isn't as high, if you have enough people catching this, you're going to have hundreds of thousands, if not millions, of deaths. Fact. It's not going to be like the flu. It's going to be 10 times worse. So stop making light of this. Stop making this into a damn meme all the time. This is getting so annoying. For people out there that have compromised immune systems, for people out there who aren't in the best shape, they are pleading with people, stop this. We do need to take this seriously because my life is at risk. Even if your life is not, you need to stop being so selfish. Because many people can die because of this. Oh, big, so what? Thousands of people of the, die from the flu every year. So what, right? So what? I am so sick of this. Continuing on. What does a caseload of this side mean for the healthcare system? We'll examine just two factors: hospital beds and masks, among many, many other things that will be impacted. The U.S. has about 2.8 hospital beds per 1,000 people. With a population of 330 million, this is 1 million beds. At any given time, 65% of the beds are already occupied. This leaves about 330,000 beds available nationwide. Let's trust Italy's numbers and assume that about 10% of cases are serious enough to require hospitalization. It's more like 20. Keep in mind that for many patients, hospitalization lasts for weeks. In other words, turnover will be very slow. It's not like the flu. You can get out in 3 days. But if you're hospitalized, you're going to be there for weeks. Good point. By this estimate, by about May 8th, all hospital beds in the U.S. will be filled. This says nothing, of course, about whether these beds are suitable for isolation of patients with highly infectious virus. If we're wrong by a factor of 2 regarding a fraction of severe cases, that only changes the timeline of bed saturation by 6 days in either direction. If 20% of the case requires hospitalization, we run out of beds by May 2nd. If only 5% of the cases require it, we can make it until May 14th. 2.5% gets us to May 20th. This, of course, assumes there's no uptick in demand for beds from other causes, which seems like a dubious assumption. As healthcare systems become increasingly burdened, RX shortages, prescription shortages, etc., people with chronic conditions that are normally well managed may find themselves slipping into severe states of medical distress, requiring intensive care and hospitalization. But let's ignore that for now. All right, so that's bed. Now's masks. Feds say that we have a national stockpile of 12 million N95 masks and 30 million surgical masks, which are not ideal, but better than nothing. There are about 18 million healthcare workers in the U.S. Let's assume only 6 million healthcare workers are working on any given day. That is likely an understatement, as most people work most days of the week. But again, I'm playing conservative at every turn. As COVID-19 cases saturate virtually every state and county, which seems likely to happen any day now, it will soon be irresponsible for all healthcare workers to not wear a mask. These healthcare workers will burn through N95 stockpile in 2 days if each healthcare workers only get 1 mask per day. They switch them out all the time. 1 per day would be neither sanitary nor pragmatic, though this indeed is what we saw in Wuhan, with healthcare workers collapsing on their shift from dehydration because they were trying to avoid changing their PPE suits as they cannot be reused. How quickly could we ramp up production of new masks? Not very fast at all. Guess where they come from? The vast majority of manufacture overseas, almost all in China. Even when manufactured here in the U.S., the raw materials are predominantly from overseas, against predominantly from China. This is what happens when we get all of our stuff from China. We're so dependent on it. Keep in mind that all countries globally will be going through the exact same crisis and shortages simultaneously. We can't force trade in our favor. Now consider how these two factors, beds and mask shortages, compound each other's severity. Full hospitals plus few masks and healthcare workers running around between beds without proper PPE equals a very bad mix. Healthcare workers are already getting infected with even with access to full PPE. In the face of PPE limitations this severe, it's only a matter of time. Healthcare workers will start dropping from the workforce for weeks at a time, leading to shortage of healthcare workers. Then further compounds both issues above. We could go on about the thousands of other factors, numbers of ventilators, or even simple things like saline drip bags. But you see where this is going. It's called being unprepared and having shortages, an overburdened system. Importantly, I cannot stress this enough. Even if I'm wrong, even very wrong about core assumption like percentage of severe cases or current case numbers, it only changes the timeline by days or weeks. This is how exponential growth in an immunology naive population works. Undeserved panic does not do any good either, but neither does ill-informed complacency. It's wrong to assume the public by saying only 2% will die. That's what I was just saying. People aren't adequately grasping the national and global systemic burden wrought by this swift moving of disease. I'm an engineer. This is what my mind does all day. I run back of the envelope calculations, try to estimate order of magnitude impacts. I've been on high alarm about this disease since January 19th after reading medical indicators of the first paper emerging from Wuhan. Remember, we were talking about that. We were talking about this back in June, saying this could be the next big pandemic. Nothing in the last 6 weeks has dampened my alarm to the slightest. To the contrary, we're seeing abject refusal of many countries to adequately respond or prepare. Of course, some of the estimates will be wrong, even substantially wrong. But I have no reason to think that there'll be orders of magnitude wrong, even if your personal risk of death is very, very low. Don't mock decisions like canceling events or closing workplaces as undue panic. These measures are the bare minimum we should be doing to try to shift the peak, to slow the rise in cases so the healthcare system are less overwhelmed. Each day that we delay an extra case is a big win for the healthcare system. And yes, you should prepare to buckle down for a bit. All services and supply chains will be impacted. Why risk the stress of being ill-prepared? Worst case, I'm massively wrong, and you now have a nice bag of rice and black beans to burn over the next few months and enough Robitussin to trip out, right? One more thought. You've probably seen multiple respected epidemiologists have estimated that 20 to 7% of the world will be affected within the next year. If you use 6-day doubling rate I mentioned above, we'll land at 2 to 6 billion infected by sometime in July this year. Obviously, I think the doubling time will start to slow once a sizable fraction of the population has been infected. This only makes sense, okay? The disease is going to go to where, and it's going to want to go into an environment where it's not already present, so it has more resources to keep going. So I think that this Liz Specht, even though this isn't anything new, she's coming from a point of authority, and she's also making a lot of sense. That while we don't need to go into complete freak-out mode over this, at the same time, we need to understand what this will do to our healthcare system and why it's going to cause issues going forward. We need to be realistic about this type of stuff, and we need to prepare. To just simply sit back and say, you know what, this is just nothing. And we're taking our cues from the president for the most part. The president, for the most part, is almost ignoring a lot of the stuff that's coming out of the CDC, and a lot of the medical professionals out there are trying to tell him what he needs to do. Now, I'm not saying that Trump is ignoring everything, but he has his hunches about stuff as well, which he needs to keep to himself because he is not a medical professional. He is a leader, and he should be trying to calm the public, but he also needs to prepare the public as well. I think that Trump really sees this for what it is. I don't think he's a stupid person. He sees this as a problem going into the next election. Now, if there was an election coming up in the next 6 months or so, then I don't think that I think that he would be taking this a little bit more seriously, and I think he would be a little bit more realistic about what's really going on, instead of just trying to spread this peanut butter all over the place and try to make everything calm. I understand that he wants to make everyone calm. I know that no president wants everyone, the public, just running around and freaking out and buying a toilet paper. I mean, what is going on with the toilet paper? I mean, have you seen this? I mean, it's a short video, but there's so many instances. I think there was a video here recently about two women that were duking it out over maybe the last thing of toilet paper. I don't know what the obsession is over toilet paper, but over the last few days, everyone just seems like they want to talk about toilet paper. They want to stock up on toilet paper. I mean, I would probably be stocking up on like non-perishable items, really. Because you might have to self-isolate for a while, especially if this does start to explode. There's a lot of people saying, no, it's only... Remember when people said, well, there was only like 10 cases here? And now it's like almost 500. Okay? And next week it's going to be into the thousands. And then tens of thousands. I hope that doesn't happen. But there is a good chance that it will. This virus will have to run its... it's going to have to run its course. And based on the response that we have had to this virus right now, I don't think the response has been very, very good at all. I think that we have simply traded a lot of the economic types of benefits or short-term benefits for the long-term punishments for the healthcare system that we're going to be going through shortly over the next few weeks. Most people who are saying this, we all hope that we're wrong. But a lot of people out there, including myself, we're rationalists, we're realists, and we can see where certain things are going. And it's not like we want these things to happen, but you have to understand where you're going first. You can't just go through everything blind and hope that you don't fall off a cliff. You have to open your eyes and see what's in front of you first. On to a few other types of articles here. Don't test, don't tell, the bureaucratic bungling of the COVID-19 test. So this is like ground zero for a lot of the problems with the COVID-19 testing kits. On Thursday, February 26th, Donald Trump finished up his initial White House press conference on the coronavirus. He had appointed Pence as coronavirus czar and spoke about the 15 cases that would go to zero. Yeah, well, that didn't happen, right? At the same time, I believed received a Twitter DM from a physician that included screenshots of an email that had been sent to staff of the UC Medical Center. And let me see. Since that original email had been confirmed by UC Davis and reported by multiple news organizations, here's a copy of the email reported by NPR. And this kind of just goes through what happened with the test. Since the patient did not fit the existing CDC criteria for COVID-19, a test was not immediately administered. The facts are clear-cut. A patient came out of another hospital on Wednesday, February 19th, 1 week before the email, already incubated and on a ventilator, and the doctors at UC Davis, who have treated other coronavirus cases, immediately suspected coronavirus infection, but the U.S. Center for Disease Control, an organization with the sole authority and ability to administer coronavirus tests, refused to test. So there was a lot of bureaucracy going on with the type of test that they wanted to order and all this kind of stuff. Evergreen Healthcare recently has refused to test people using the nasal test because they're just, number one, there wasn't enough to go around because there's just a lot of people coming in with some like symptoms of the coronavirus, and there's just not enough tests to go around. There's just not enough of them. So a lot of these people are just going without tests, and that's one of the biggest issues. That once we do have enough tests, you will see the test basically, or the numbers, go through the roof. Moving on here. Italy is to quarantine 10 million people in Lombardy. So a lot of people are kind of freaking out about that. Italy is set to lock down at least 10 million people in the region of Lombardy and 11 provinces in the north and east of the country. It's a mandatory quarantine that will last till early April. And they say a dramatic escalation in the country's efforts to contain the new deadly coronavirus with closed gym, pools, museums, ski resorts. So we have a lot of things that are being closing down. Business is going to be affected dramatically over the next few months. This is going to lead to a worldwide recession. It's just going to happen. And Trump or anybody else, they're not going to stop this from happening. It's happening all over the country. This virus is going to wreak its havoc. It's going to last for a few months and it'll go away. And that's exactly what's going to happen. People are going to lose their jobs. People, the businesses are going to go under. We're going to go into a recession. It's an assurance right now. It's verified. You can take it to the bank. In other words, we're going to have a worldwide recession. So obviously all the sports are being affected as well. I know there's a lot of sports fanatics out there that are reeling over this issue with there's not going to be any fans in the stadium to watch their favorite teams play. And that's unfortunate. It really is. March Madness coming up. And that's going to be very, very weird. If I have to watch March Madness with no fans in the background, I might not even watch it. I might. Maybe not. I don't know. Because it's just, I can't imagine just watching a sporting event with no fans there. It would seem like it would be really weird and really boring. But that's just me. I think most people can agree with that. Moving on, so there was another post out of Breitbart a couple days ago. China cannot explain death of cured coronavirus patient. We were talking about this a few weeks ago, where the reinfection rates were an issue. Chinese woman named Wang Mai is demanded to know why her cured husband died of coronavirus 5 days after he was released from the Wuhan Medical Center. Now, this might have been an issue where he might have not been cured. You know, they might have just been sending him home because of what? Of the problem with overpopulating the hospitals. They just don't have anywhere to put all these people. The same thing's going to happen with this country, too. We think the United States is just impervious to everything. But our healthcare system is not as big as a lot of people might think. And it's going to get overburdened really fast. I talked about, there was some from Democracy Now! Roundtable, coronavirus is best case for Medicare for all. I am a proponent for Medicare for all. Yes, I know that there's a lot of people saying that it would bankrupt this country, but I simply don't believe that. I think there's a lot of positive results, especially that Yale case that came out that says it would actually save money. I think that we waste a lot of money in the healthcare industry already. I mean, billions and billions and billions of dollars just wasted every single year. So people that are saying that it would cost trillions of dollars and would bankrupt this country, I don't think they're looking at all of the numbers, at all of the waste that we actually that goes into the medical industry right now. That's all I'm going to really say about that. Coronavirus recovery is all fake. There's a lot of people that are in China right now that are saying that this whole thing with this whole so-called recovery is fake, and there's people that are basically collapsing in their workforce. You know, China's trying to get people back to work, but some of the people that are going back to work, they're just collapsing, you know, on their workstation. China's claims that of how it's handling coronavirus recovery should be taken with more than a few grains of salt even before COVID-19 became a global crisis. Chinese leaders have been criticized for their handling of the situation and lack of transparency about the disease progression. Things now look like they're on the upswing, and businesses now even appear heading back to work. But whistleblowers and local officials tell Xizan that's just a carefully crafted ruse. There are people that are screaming that it's all fake. It's all fake. When Wuhan officials have tried to make it appear recovery efforts are going smoothly, but when central leaders personally survey disinfecting regimens and food delivery, local officials make a special effort for them and them alone, one resident told Xizan. And in a video circulating on social media, residents can be seen shouting at visiting leaders from the apartments where they are being quarantined. Fake. It's all fake. Remember that movie? God, I can't remember what it was called, but it was where a reporter goes to North Korea. And you know which one I'm talking about. Anyway, where he's basically showing him all of the wonders of North Korea, and then he finds out in the end that it's all cardboard cutouts. It's all fake. Maybe this is what's going on as well. Maybe China knows that it's on the cusp of a complete collapse of its economy and will do anything to stop it. You can't blame them. But you know what's going to come first in this world? Is it going to be the economy, or is it going to be people? And I think a lot of people are waking up to that. And I think this whole coronavirus is a good way to actually discuss this, and it actually shows it for what it is, and it reveals that very, very important question: what's more important? Is it the economy, or is it money? I mean, or is it people? Because even in this country, we are trying to sweep everything under the rug to save the economy and to save the perceptions of how healthy we are as a country economically. But I think when we get to a point, we have to put that to the side and care for our citizens. And that is why this makes a case for Medicare for all. Because while it might not be the best for the economy, we have to look at all the numbers and we have to see it for what it really is. But not only just the whole Medicare for all type of argument. These are people we're talking about. The people that are actually coming down with this virus and are dying. When someone dies, it's a tragedy. I don't care who it is. And the people who are saying, well, people die every year, so what? Those people need to look themselves in the mirror and they need to ask themselves, well, what if that was your mother, father, daughter, son, brother, sister, aunt, uncle, nephew, niece, whoever, grandmother, grandfather? What if it was them? What if they were falling ill and dying in the hospital? Would you care, or would you just say, well, 10,000 people every year die from the flu, so effing what? That is the attitude that we have in this country right now, and it's going to cause this issue that Liz Spector was talking about, and that a lot of people are talking about, that we are going to enter, that the United States is going to suffer from one of the worst pandemics ever. At least there's a possibility of that, a good possibility of that happening, because we are not employing the types of measures that other countries are employing in their countries, because they are taking it seriously. We are not. We're not taking anything seriously. We're too concerned about the stock market. We're too concerned about conspiracy theories about other countries trying to take down Trump. This is ridiculous. When will this nonsense end? It's time to put the memes to the side, and it's time to just start taking this seriously. It's not just like the flu, and it's not Ebola either. But at the same time, this could turn into a huge issue. It's a death by 1,000 paper cuts, people. That's the only analogy I can come up with. And it's not going to just affect, it's not just the mortality rate we're concerned about. It is the whole economy in general. And it's the healthcare system in general. And when the healthcare system is overburdened, guess what? It's not going to just be the people dying from the coronavirus. It's going to be other people as well who can't get the type of medical treatment they need because of all the ICU beds being filled. Please consider that before you make your next meme. Until next time, this is Joe with Simple Life. Have a great day. I'll see you in the next one. Bye.